record on the computer, and it is recording. Ariel saves the day. Here we go. So when you're calculating, it's the same as adults. We're calculating for oral medications, IV medications, rectal medications, any other drugs we have to calculate for pediatrics and kids and neonates. In fact, I think those, it's not my world, but I think those pediatric nurses, they calculate it like 2-3 times and then have the pharmacy verify it, and it's added security for the kids. This review stuff, we don't need to look at it. It's 1 ounce, 30 ml, pounds into kilograms. We don't need that. And this nomogram, we also don't need to look at it. You guys have been looking at it over the past few, I think it was last week, where you connect the dots. It's simple, but keep in mind when I'm going to ask you questions on a test for body surface area, it's not it. We actually have to do the math on it, which is coming up. I will skip this part. I don't know why I put the review. Okay, so average body surface area for kids, it's right here. Here's the list. Depending on the age, there it is. And for the adults. Basic numbers, there's not much here to memorize. But what you do need to memorize is this. Body surface area. Now we're going to calculate it. And here's the formula for it. It's still simple math. There's a little bit of square root there. It's not as complicated as you think it is. So if your anxiety just went up because of the square root, don't. It's not as bad as you think. So there's the formula for body surface area. Height in centimeters times weight in kilograms over 3,600, and the square root of that. So now looking at this formula, you're probably going to see the height is in centimeters. So the question may be in inches, maybe in feet. So you have to do some conversion. Same as the weight. You might get it in pounds, maybe even ounces. So we'll work through that. Speaking of working through it, let's just do it. So here's 3 different examples of on 3 different variables and how to calculate the body surface area. If you look at the first one, the height is given in inches. You have a weight, 26 pounds. We need the body surface area on that. The middle one, it's given to you in centimeters and kilograms. Oh, that's perfect. I don't have to do any conversions with that. The last one, 50 inches and 75 pounds. I might have to do a little bit of conversions with that, and we're going to work through it. Let's start with this number 1. Height 36 inches, weight 26 pounds. Let's solve for the body surface area. And here it is. Boom. Just like with any other problems, I'd like to write out my formula so I can see it. I'm a visual guy. And it's a matter of plugging in some numbers. Body surface area, height times weight over 3,600, square root of that. I have 36 inches. I have to convert that into centimeters. Multiply it by 2.54, and I have, what is that, 91.44 centimeters. All right. Next, I have to convert my 26 pounds into kilograms. 26 pounds divided by 2.2 is 11.81. You see some rounding issues up there already. I'm going to tell you question per question on how to round. Let's say for this question, I might say round to the nearest hundreds, maybe tens or whole numbers. So there's no generic rounding rule. And from there, as you can see, I'm just simply plugging it in. 91.44 times 11.8 or 81. What is that? 1,079 something. 0.91. I guess I rounded to the hundreds on this one. Divided by 3,600. Let's silence this thing. Answer is 0.029. Oh, I didn't give you instructions to round it off there because I'm not done. We got to take the square root of that. 0.29 square root. And there it is. If you're in 0.53 or 0.54, if I'm going to tell you to round it off to the nearest hundreds. If you're not familiar with how to use the square root button on your calculator, it's this little button right here. Next, let's do this one. The middle one, where the height is given in centimeters, weight is given in kilograms. This is fairly straightforward from my end. I'm plugging it in straight to the formula. What was my height again? 80 centimeters. Weight was 13 kilograms, I believe. All right, let me plug it in my formula. BSA, body surface area, is the square root of height times weight over 3,600. Plug in some numbers there. 80 times 13 kilograms over 3,600. Square root of that. So far, we're working with simple math here. Nothing complicated. Actually, there's nothing complicated with any of these math. There's my 0.28 or 29, but I'm not done. I have to take the square root of that. So please, please, please do not skip this part when come test time. You may think you're done with the final answer here of 0.29, but there's one more step. You have to take the square root of that and then follow the rounding rule I'm going to give you. In these cases, I'll probably tell you round to the nearest hundreds. This one's fairly straightforward. Next question is this one to the right, where it's given to you in inches. You already know I'm going to have to convert that into centimeters and pounds. I need that in kilograms. Let's work that out. My height is 50 inches. I need that in centimeters. Weight is 75 pounds. I need that in kilograms. Remember all these conversion from, I think it was test 1 or week 2 or 3. It's coming up and you are going to have to know it from now on. I just converted my height into 127 centimeters. My weight, 75 pounds to 2 divided by 2.2, 34.09. Here's my body surface area formula, 127 centimeters times 34.09 over 36. Let's do some math. 127 times 34, come on button, times 34.09, 4,329.43. Divided by 3,600. 1.20. Remember, that's not it. You gotta do I need the square root of that. Do not. I can already see some of you guys will skip the square root part. There's my BSA, 1.1. Next. I have this problem right here. A 2-year-old child, now it's going to get a little complicated, but not really. A 2-year-old child with a weight of 27 pounds and 12 ounces and a height of 35 inches is prescribed this medication. 5.5 milligrams PO by mouth every 6 hours for the next 72 hours. Okay. The literature states dose of leucovorin for rescue after whatever the therapy is 10 milligrams per millimeter squared per dose. Q6 hours times 72. That's a lot of information. It comes in 1 milligram per ml from the pharmacy. The question is, how much do you need to give your patient? A lot of information. At the end of the day, you're the nurse, you're going to give this kid this medicine. How much are you going to give this kid? There's a couple of steps. Let's work through that. There's 4 steps into working this out. And here they are. Step number 1, steps and rule. Find the body surface area in meters squared. Next, determine the safe dose using the reference. Remember in the question, I think it says the literature says safe dose is, I forgot what it was, 10 milligrams per millimeter squared or something like that, but we'll get back to it. Next, decide whether the ordered dose is safe. If it's safe, hey, we can move on. We can calculate the rest of the medication so we know how much to give our patient. If it's not a safe dose, stop. There's no need to move on from there because we're not giving this medication to the patient. It's not a safe dose. There's steps and protocols to follow after that, but it's not negotiable if it's not a safe dose. Next, if it is a safe dose, now I need to know how much am I going to give the patient? Am I going to give them 5 ml of this, 10 ml? I don't know. We have to figure it out. So let's work through that. Step 1, find the body surface area. There's the information up top. Why am I not writing? So my height is 35 inches. So weight is 27 pounds and 12 ounces. Oh, I have to do some conversions on this. Convert pounds to kilograms. 27 pounds and 12 ounces. First, remember the 12 ounces, I have to divide it by 16 to get into pounds. So now I have 27.75 pounds. And when I get there, I have to take my 27.75 and now convert it into kilograms by dividing it by 2.2. So now I have 12.61 kilograms. Next, I have to convert my inches to centimeters. 35 inches times 2.54, it will give me 88.9 centimeters. All right. I'm not done. I got to get my body surface area from here. I need to have my 88.9 height times weight in kilograms, 12.61 over 3,600. All right, let's do some math. Calculate. The numerator is 1121.029 divided by 3,600. 0.31. Remember, I got to take the square root of that for my body surface area. And there it is, my square root. 0.55 meters squared for my body surface area. Boom, there it is. That's just step 1. Now, next, step 2. I need to know if this is a safe dose. The safe dose instruction is right here. Literature states dose of leucovorin for rescue is 10 milligram per meter squared per dose, Q6 times 72 hours. So how do we determine if this is a safe dose? There, it's right here. I'm going to take my body surface area, 0.55 meters squared, times the safe dose. It's 10 milligram per meter squared. Dimensional analysis here. I'm going to cross off my meters squared. I'm going to multiply it. 0.55 times 10 equals 5.5 milligrams per dose. Is this a safe dose? I don't know. The literature says yes. So based on the literature, we are administering a safe dose because the ordered dose is right up here. I don't know if you can see my mouse. The prescribed dose is 5.5 milligrams per PO. Based on our calculation here, the safe dose for this patient with this height and weight is 5.5 milligrams per dose. So yes, this is a safe dose. I have my safe dose. I'm ready to go. Now, the next question is, how much are you going to give my patient? I don't know. Let's find out. Let's calculate it. Calculate the dose. I have 5.5 milligrams per dose. I'm using dimensional analysis here. And the medicine comes in 1 ml per 1 milligram. There we go, crossing off my milligram. Multiplication there. So now, nurse Samantha, is going to administer 5.5 ml to this patient for this safe dose of this medication for the patient. Lots of steps, lots of steps. Just be careful when calculating, because one step, if you mess up, say, the body surface area, maybe even the conversion from pounds to kilograms, that one little thing will throw off the entire question. So be careful with that. Follow the steps. Skip that one. So next, calculating pediatric fluid requirements. It's easy for adults to kind of guesstimate their fluid requirements, especially in for septic. Actually, for septic, it's precise. But for the most part, if I have a patient who's hypotensive, most of the time your physician's going to go, oh, their blood pressure is low. Give them 500 cc normal saline bolus. Give them 1 liter normal saline bolus. Well, that works well for adults because we have a lot of playroom with them. Not for pediatrics or neonates. There's a precise formula that we follow for these guys because we don't want to give them too much fluid because they have little bitty hearts. They have little bitty bodies. If I give this kid a 500 bolus, they're going to go to CHF right away. So here's the formula for that. Formula to calculate daily maintenance fluid requirements. How much are they going to need? Number one, 100 mLs per kilograms for the first 10 kilograms. Next, plus 50 mLs per kilograms for the second 10 kilograms. Next, 20 mLs per kilograms for the remainder of weight in kilograms. It sounds complicated. It's not. Wait till you see it on paper. So here's the problem. A nurse is caring for a child who weighs 46 kilograms. What is the child's daily maintenance fluid requirements in mLs? Here it is. There's my formula again. I like to write it out. 100 mLs per kilograms for the first 10 kilograms. My patient weighs 46 kilograms plus 50 mLs per kilograms for the next 10 kilograms. Anything over that, it's 20 ml per kilogram. for the remainder of the weight. All right, let's plug in some numbers. 100 ml per kilogram. This is my first kilogram. My patient weighs 46 kilograms, is 1,000. Next, 50 ml per kilogram for the second 10 kilograms. I have 500 there. Next, the remainder, I have, how much is left over? 26 kilograms. 52, I'm gonna add all of this up. I think I was using a calculator to add it up. 2,020 ml. So my patient is this patient who weighs 46 kilograms is gonna require 2,020 mLs fluid for the whole day. Okay. Let's do it again. Same formula, 100 mLs per kilograms for the first, 50 for the second 10 kilograms. I'm not going to give this formula to you. You have to know this, which is fairly easy to remember, 100, 50, and 20 for the rest. So my patient in this case weighs 31 kilograms. So I have 10, 10, and 11. Let's work it out. 100 ml per kilogram times 10. We have 1,000 over there as the base. My second 10 kilograms, 50 ml per kilogram times 10. So far, I have a grand total of 20 kilograms. Okay. Simple math, simple math. 20 mLs per kilogram for the remainder, which is 11. $22. Add them all up, and this is my grand total for this child's daily fluid requirement. Simple math, simple math. Now, let us calculate some IV infusion rate for this kid. As always, IV infusion rates are in mLs per hour, and we're going to use the ratio here of 20 mLs per kilogram. So here's a question. The IV infusion of 20 mLs per kilogram over a 2-hour period for a child who weighs 10 kilograms. Calculate the infusion rate. It's not as complicated as you think. See, watch. I have a patient who weighs 10 kilograms. And they need 20 mLs per kilograms. Dimensional analysis there, cancel the kilograms. I have 200 mLs. My 200 mLs, I have to give that over 2 hours. A little bit of division. It's 100 mLs an hour. Some of you probably just did this in your mind, in your head, but you can. As you can see, the math is simple. But for testing purposes, put it on paper. So if there's any discrepancy, we can look back, talk about it. Maybe you sneezed and wrote here 2,000 ml instead of 200. And we can talk about it when we get there. That's it. I think that's all I have. This was easy. I gave you 2 formulas today. Practice these formulas. I'm telling you now, it's going to be on the test. Because you're going to see these again, and you have Professor Tabor, you have all your med-surg instructor professors. They're going to get mad at me if you can't calculate these things. Plus, I'm also going to be there within the next couple of semesters, and we'll test on these. This is not a one-time thing. I'm building up on your dosage calculations. because you're going to use it from now on. Just like I think it was on the last test. Somebody says, oh, I didn't know we had to use that, I think, ounces to mLs again. Yes, you are. That's all I got. Questions. There's our homework. I'll talk to you, June. Let me look at it. I don't know if it's there. It might be gone. But I'll get back with you, June. If there's any other questions, we have a couple more weeks left. I'm going to do a survey right now. This is a live survey. I'm thinking about doing a live finals review. Yay or nay? You guys think about it and let me know. Oh, yeah, that was an instant yes. Well, okay. All right. Okay. I was going to say, think about it. And I know it's through the Thanksgiving weekend. We're all okay. I guess unanimous. Think about it. All right, everything's a yes. So we can do that. I can do that. I'm here in town. I'm not going out of town, so I'll be here anyway. The campus should be open, but yeah, you can do some a live finals review, and if there's any questions, we can hash it all out from there. So far, I have a yes. It'd be one. Yes, that's why. It would be Wednesday, right before Thanksgiving, 10 to 11. So if I know some of you guys might be going out of town, might have some family. So I'm taking that into consideration. But I think it's better in person so we can kind of see. If you don't get something, I'm going to ask you some questions. So here you go, calculate that. And I just think it's a better experience. So you can still think about it. I know it's unanimous today that it's a live finals review, but still think about it. So as of now, I'm going to plan on doing it. All right, guys, that's all I have. I will see you next week. See you on campus. Say hi to me if you see me on campus. Who is that? Who said hello to me? You don't say hi to me. I don't bite. I know. Yes, Sarah, I knew that was you. You didn't have to tell me you were in, you didn't have to tell me it was you. I knew it was you. Now you know where my office is. Usually if you're on the 3rd floor, follow the music. I have music playing. I kind of figured you were lost. You were not supposed to be there. All right, guys. I know I was like, where is, oh, the lab on the 3rd floor? Is there a lab on it? I don't think that there's a lab on the 3rd floor. That's what I thought.
No, I was looking for the computer lab. I wasn't paying attention. I know it was on the 2nd floor, and then all of a sudden I just saw the window, so I got lost.
Oh,
Then I saw you, so it was okay.
I thought you were Uber Eats and was delivering some food. I got excited to see you for a minute.
No, it wasn't me.
All right, guys, I will see you next week. Goodbye.